Welcome, everyone. We're so pleased that so many of you could join us here today. I think there's quite a cross-section here in the audience. I think I've heard a number of you are students and a number of you are here from the community. And we're also going to be having people joining us by web, which will be really nice. And the hashtag, for those of you who want it, is on there, Women's X, so maybe keep that in mind. So when it comes to women's health, we believe thinking outside of the box to do research that makes a real difference in the local communities. The health of women is really important to the health of families and to communities. We know that health can be complex, and we know that it goes well beyond what's done in the doctor's office. So it's for this reason that with the support of the Ministry of Health and Long-Term Care, we've established the Women's Xchange. It's here to grow Ontario's capacity to advance research that improves women's health. The Women's Xchange will create and strengthen links between diverse groups, and it works to touch on women's health, even including people who might not have thought that they had a role to play in health. So we're looking at non-traditional health care and including that in the idea of women's health. It will also facilitate the transfer of knowledge to people who potentially can really use it. So today we'd like to bring the vision of Women's Xchange to life by hosting this panel of remarkable leaders, all of whom are really making a difference to women's health from a whole variety of different unique perspectives. And by telling their stories, our panelists will help all of us take a step back and I hope see women's health from a much broader perspective. And I also think that it may well inspire us, each of us, to see how we too might contribute to women's health in our own way. So before we get started, I'd like to invite Dr. Vasanthi Srinivasan just to say a few words. And as the Assistant Deputy Minister of the Health System Strategy and Policy Division of the Ministry of Health and Long-Term Care, she has been one of our real champions for this initiative. So welcome.
Thank you very much, Paula. As we thought of this initiative, we didn't have to think too far to know where leadership lies in the community. We approached my old friend Jane Pepino, who is one of the leaders in the community, has been for decades now, on women's health. And we talked about where to house this new initiative. And I think we came to a consensus with Marilyn in about 33 seconds and said this is where it needs to be under Paula's leadership. So our thanks from the ministry to you, and what a brilliant panel you've pulled together, and I truly look forward to listening and understanding their perspectives so we can work together to advance women's health in Ontario. But you've also given me a special privilege this afternoon to introduce Valerie Pringle. I don't know Valerie personally, but I do know her from her commitment to mental health, because I have the privilege of leading the mental health and addiction strategy in the government. We focused for the first 3 years on children and youth, and we're beginning conversations with the communities to engage with us in moving the agenda beyond 3 years to a 4 to 10 year strategy. Valerie is one of Canada's best known and most respected broadcasters, but also a champion volunteer. She is a very well-known public figure, and of course, I don't need to elaborate on that introduction. I've long been impressed with how Valerie took her appreciation, her understanding, her interface with mental health issues, and came out at a time when not too many people ventured into the public arena. It's really helped us take theory, concept, understanding of issues into a very pragmatic focus to help families, help people, children, adults and seniors with very key issues that contributes to their productivity and to Ontario as a province. Valerie, you've been inspirational to me, and I'm looking forward to your moderating this very august panel. So welcome. Thank you so much for agreeing to do this.